senior plasticians in Hyderabad, India. PRP is one of the most sought after and commonly done procedure for hair growth in aesthetic medical practice, especially for hair thinning and hair loss in both men and women. Today I would like to discuss 8 things you should know about PRP. Number 1. Where is the procedure done? PRP is simple procedure done in an outpatient basis. Number 2. How long does it take? It is finished within 20 to 30 minutes. Number 4. What is PRP? How does it work? PRP stands for Platelet Rich Plasma. Human blood has many components, including red blood cells, white blood cells, platelets, and plasma. Platelet Rich Plasma is the element of blood that stimulates wound healing. It contains platelet-derived growth factor and 𝗂𝗏𝗵, which enhance the local blood supply and act as a good nutrient growth medium for the hair to grow better. Sometimes people get it done for the enhancement of existing hair for volume building. It is also recommended for post-hair transplant patients as a few maintenance doses. Number 5. How is it done? We draw blood from the client, keep it in a test tube, and centrifuge it for 20 minutes. We extract the platelet rich plasma by a syringe, which is now in a separate layer in the test tube. This isolate is now injected with a hypodermic needle into the desired area at a subdermal level. 10 to 25 ml of venous blood is drawn from the client depending on the amount of area for injection. 25 ml of blood yields around 2 ml of PRP after centrifugation. We give local anesthesia at the desired area before injecting the PRP, which will lower the pain. This procedure aims to create small controlled injuries on the scalp while simultaneously injecting PRP into that area. These controlled injuries signal the body for platelet accumulation, which promote healing. These injections are given within 8 to 10 minutes. Number 6. How many sessions do I need? These injections need to be given in sessions, nearly 10, and a minimum of 6 sessions should be given with a spacing of 3 weeks between each session. We can start seeing the results after 4 sessions. Number 7. What tests are done before the procedure? We do a few preliminary blood tests to know the blood cell counts, as this procedure is done only when the platelet levels are good and the client is not having any bleeding disorders, clotting disorders, or on blood thinners like aspirin. Number 8. Where else PRP is used? PRP is also used in other situations as an anti-aging therapy for face by injecting it into the wrinkles and folds of the face. It is used as a local therapy for better wound healing, for non-healing ulcers and ulcers from burns. Wherever there is requirement for more collagen growth and new blood vessel formation, PRP is applied there. If you found the content in this video valuable, please share, hit the like button, and subscribe to our channel for more interesting facts. Follow us on social media, links in the description below. And finally, if you would like to know more about PRP and whether it is a suitable option for you, contact our clinic at +91 40 234 61 999 or visit us at www.Revera.in. This is from Thota's Revera Clinic, Beauty Through Medicine.